Hello viewers, welcome back to my channel. In my previous video, I had talked about how students make the transition from high school to medical college. In today's video, I will talk about the subsequent journey from medical college to becoming a specialist. We will talk about the scenario in the USA, in the United Kingdom, and we'll compare it with the scenario in India. I hope you will enjoy watching this video. Stay tuned. Let's start with the United States of America again. After completing a 4-year bachelor's degree at the age of somewhere between 22 and 24 years, an American student starts medical school. Medical school in America consists of 4 years. The first 2 are pre-clinical years where most of the learning happens inside a classroom, while the last 2 years consist of clinical subjects where most of the learning happens in the hospital. To get into medical school, American students had to deal with MCAT, a 7-hour 30-minute exam consisting of 230 multiple choice questions divided into 4 sections. I have talked about it in my previous video, which can now be described as the first part of my description regarding how to become a doctor in the US, in the UK, and in India. While in medical school, Americans have to deal with USMLE, a 3-step exam that requires much more studying than MCAT. USMLE Step 1 is usually taken at the end of second year and requires 6 months of preparation. This is by far the most important USMLE step from the point of view of matching into residency. USMLE Step 2 is typically taken at the end of third year of medical school. It requires about a month of preparation. Third year of medical school in America consists of rotating through several specialties like internal medicine, family medicine, psychiatry, neurology, emergency medicine, pediatric medicine, general surgery, and obstetrics and gynecology. Fourth and final year of medical school in the US consists of something called away rotations, where one may have to work as a sub-intern in different institutions, in different specialties, in different parts of the country, for a month each. Usually these are about 2 to 3 away rotations at institutions where students want to ultimately match at for their residency. In September of 4th year, applications for residency can be submitted through the Electronic Residency Application Service or ERAS. Interviews take place between October and February. At the end of February, students submit their rank list to participate in the match process. In March, match day happens when students receive envelopes with news regarding where and in which specialty they will be doing the residency for the next 3 to 7 years. Now comes step 3, residency. Medical students have completed medical school. In the US, the degree medical students get at the end of medical school is not MBBS, it is MD or DO. Maybe I can make a different video talking about that. Now residency starts. Depending upon the subject, residency can last from 3 years to 7 years. First year of residency largely involves rotating through a vast number of subjects that may not have anything directly to do with the subject chosen for specialization. Second year onwards, one would have more focused rotations, and during this time, one can also choose some elective topics which may be specific areas of interest within the subject of specialization. Students who want to specialize further can also elect to do a fellowship after residency. This may last for 1 to 3 years and it is optional. At the end of residency, Americans can take the board exams and become board certified physicians or surgeons. So if we compare with the scenario in India, MCAT is analogous to NEET UG, USMLE is similar to NEET PG, board exams resemble the university exams at the end of post-graduation in India. I should probably make a different video comparing these exams individually. Interestingly, America does not have a NEET SS equivalent. Another point that I should mention here is doctors studying in India can also participate in USMLE Step 1 to match into residency training in the US. And as we have seen in this video, Americans complete residency around the age of 28 to 35 years at the earliest. So a short recap of the American traditional path to becoming a doctor after high school: 4 years of bachelor's degree from a college or university, followed by 4 years of medical school, followed by 3 to 7 years of residency, followed by an optional 1 to 3 years of fellowship, and then one can become a board certified physician or surgeon in America. That's somewhere between 11 to 18 years, assuming one did not take any gap year high school onwards. Now let's hop over the pond and find out the system in the United Kingdom before I tell you about the system in India. Now let us talk about the scenario in the United Kingdom. In the United Kingdom, one does not require to participate in an entrance exam because there are no entrance exams to medical colleges in the UK. Entry into medical colleges depends upon the performance in the 10th board exams, which are called GCSE in the UK, and 12th board exam, which are called A levels or advanced levels in the UK. I have made a video talking about this, you can check it out, which can now be described as the first part of my description regarding how to become a doctor in the US, in the UK and in India. The medical students stay in medical colleges in UK for a duration somewhere between 4 to 6 years, at the end of which one starts 2 years of foundation training. This is followed by 2 years of core training. After core training, one can choose to appear in an exam like MRCS if one wants to go into surgical specialist training. After successfully passing MRCS, one can appear in a national interview for a specialist registrar post, which is called ST3 in the UK, and depending upon the surgical specialty, specialist training can last somewhere between 4 to 6 years. In ENT, specialist training is of 6 years duration. At the end of training, one gets a certificate of completion of training, which is also called CCT. After CCT, one can pursue fellowship in areas of further specialization, and of course one can appear in FRCS exam, upon successful completion of which one becomes a consultant in the United Kingdom. Now we have talked about this, let's compare it with India. In India also, the MBBS curriculum is roughly 6 years in duration, but the foundation training is not of 2 years, the concept of core training does not exist, and specialist training pathway is not of 6 years duration. So what is the scenario in India? Let's talk about it in the next part of this video. So let's talk about the scenario in India. Before I get into it, I must get the disclaimer out of the way that the scenario in India keeps changing. So it's very difficult to keep track of, to be honest. The system that I had encountered in 2008 is vastly different from the system that exists in 2024. So I'm probably not very confident that it might stay the same in the future as well. But let's talk about the current scenario. As I have previously talked about in the first part of this video, if a school student wants to join a medical college in India, they have to appear in National Eligibility cum Entrance Test for undergraduate medical courses. This is a 3-hour 20-minute exam consisting of multiple choice questions of physics, chemistry and biology. For each correct answer, a student gets 4 marks. For each wrong answer, there is negative marking of 1 mark. There are 200 questions, but for reasons that I don't understand, only 180 should be attempted. And if you get all 180 correct, you can get a score of 720, which might be triggering for some viewers. Now, once you've participated in the counseling process, you've joined a medical college, the medical college duration in India, the curriculum duration in India is 4.5 plus 1 year. What do I mean by this? 4.5 years of studying and 1 year of internship. At the end of which, medical students in India get a degree called MBBS, Bachelor of Medicine, Bachelor of Surgery. Once a student in India gets MBBS degree, they are registered medical practitioners, they are basically doctors. Now they can choose to work as a doctor with an MBBS degree, or they can choose to participate in the postgraduate course for further specialization. Now if you want to specialize in a subject in India, then you have to appear in an entrance exam called NEET PG. PG for post-graduation, NEET same as NEET UG. Now for some reason NEET PG is a computer-based exam, but NEET UG was a pen and paper-based exam. I suppose the assumption is during medical college students figure out how to use a computer, although there is no formal training in computer use. I believe the only time I used a computer during medical college was when I was playing Far Cry. So, for some reason, NEET PG is a computer-based exam. This is also a multiple choice question exam, and the pattern of this exam I will not discuss in this video. So once you have successfully passed NEET PG, then you join a postgraduate course. This may be, also there's another postgraduate entrance exam called INI-CET. This is for premier medical colleges like AIIMS. So there is NEET PG and there is INI-CET. These are the two exams that Indian MBBS graduates can take to participate in further specialization. So postgraduate degree can be MS, can be MD, can be diploma, or it can be DNB. Of course, diploma is for a degree, but MS, MD and DNB are equivalent. MS is for surgical subjects, MD is for medical subjects, and DNB is the same degree for all subjects, whether it is medical or surgical. DNB is provided by the National Board of Examinations, whereas MS or MD are provided by state universities. Are you confused already? Please stay with me. So after post-graduation, which is of 3 years duration, doctors in India need to appear in a university exam or a DNB exam to obtain their specialist degree, which, as I said, can be MS, can be MD, can be DNB. If someone is pursuing diploma, then it's a 2-year course, at the end of which again they have to appear in an exam to get the diploma, which may be, as an ENT, it may be diploma in otolaryngology or DLO. Now, after one has become a specialist in India, one can choose to pursue further specialization, which is called a super specialist degree. For a super specialist degree, which again is of, I think, 3 years duration, one needs to appear in another entrance exam called NEET Super Specialization or NEET SS. Again, there is an equivalent exam called DNB Super Specialization or DNB SS, but that's how it is. So again, you can do super specialization in a medical subject and get DM, or in a surgical subject and get MCH. Again, if you are doing super specialization through the DNB route, then this degree is DNB for both. So what is super specialization? An example. So if someone has done specialization in general medicine, he becomes MD general medicine, and then they want to do super specialization in neurology, then they get something called DM neurology. So their degree becomes MBBS MD DM. So what is the entire duration? There is 5.5 years of MBBS, followed by 3 years of post-graduation, followed by 3 years of super specialization, which brings the grand total at 11.5 years. Remember, the duration in America was also 11 years, and in UK also the duration is what? 6 plus 4 plus 6, 16 years. So India is doing a good job in terms of duration. However, the biggest caveat here is people usually don't get into each subsequent step in the first attempt, and there is no attempt limit in India, thankfully. So I hope you are aware of the systems in the UK and in the US and in India, and happy Doctors' Day to all of you.